Hey everyone, I'm Drex, and this is Unhack's 2.5 minute drill, a special overtime edition. Now, normally I start this off by saying we're going to talk about three stories 2 times a week for one great community, the 229 cyber and risk community here at This Week Health. But because of all the sort of ongoing events that change healthcare and some of the conversations I've had at Vive and some of the messages I've received since then, I'm going to do something a little different. I released part one of this two-part overtime series yesterday. And in that, I talked about the history of a ransomware adversary group known as ALPV or Black Cat and the special interest they've taken in attacking healthcare. I also got into the connection between Black Cat and their part as the now acknowledged e-crime syndicate responsible for causing the current cyber event at Change Healthcare. That incident's been going on for more than a week, and I'm hearing there may be some recovery in progress. But the event has really upset the apple cart all across US healthcare. Claims can't be submitted, prior authorizations can't be submitted or confirmed, patient eligibility can't be checked. Even in some places, electronic lab and pharmacy ordering has been interrupted. And that's just part of the ripple effect of this cyber attack. Not only that, Black Cat has stolen multiple terabytes of data from a large number of Change Healthcare customers, which includes some of the largest organizations in the country. They'll likely hold that data hostage and ask for payment in exchange for a promise to delete the data, or they'll post it to their data leak site on the dark web. Think of that sort of as an underground version of eBay, where the data will probably be sold to another cyber thug who's the highest bidder. But this whole problem isn't easily solved in healthcare. Generally speaking, we're not the most cutting edge industry when it comes to cybersecurity, but that's not because our healthcare teams aren't trying hard. So today, after hearing earlier in the week from a CIO friend who went on a bit of a rant, and rightly so, about the current situation, I thought I'd hit on 5 or 6 items that healthcare organizations should be thinking about when it comes to building an easier to protect organization. Now, look, the stuff I'm going to talk about, if you're a cyber professional, will not be a surprise. We've talked about all this before, and it's likely the same for the CIO. But for other executives in your healthcare organization, the Change Healthcare cyber attack is a great opportunity to start a discussion and educate them about the interconnectedness of so many things that need to happen to improve our security posture. And if these videos help, great. That's exactly what I'm here for. As a lady once said, never waste a good crisis. And at this point, I think we might be able to call this a crisis. So here's a few things for discussion. Again, when I talk about this stuff, I try to make it mostly plain English, mostly non-technical. So be sure to share this episode and part one with your teams and your peers and your leaders. They need to hear what's going on too. And by the way, these discussions are super high level. In this episode, I'm only giving a few lines to each topic at this point, but count on each of these points having a full blown episode in my new show, Unhack the Podcast, coming very, very soon. Discussion point one, spending and modernization. Now, odds are you're not spending enough on security to win the war you're fighting, and you should have no doubt at this point that we're all fighting a war. But it's not always about security spending. You need to spend to modernize old equipment, PCs and network and software and medical devices. Those modern things are way more likely to be supported by manufacturers and therefore easier to update, easier to patch, all that happening when there's so many new vulnerabilities being found. We all hope for government grants and programs to help us fund these improvements, but I'd recommend you not wait. If at all possible, make progress now. Point two, speaking of patching, that's a very hot topic. There are more vulnerabilities being announced now than ever before. Many of them are more urgent than ever before. So check your processes. Know what patches are out there for all the stuff on your network, which means first, you have to know all the stuff on your network. Do you really? And prioritize those patches. Some are more urgent than others. And when it comes to patching, let me coach you on one more thing because I hear it all the time. Your organization must develop a tolerance for the downtimes associated with security patching. Your teams often have to take apps or equipment offline to do those patches. So fly top cover for your teams on that downtime issue. I promise they'll appreciate it. And I promise it's incredibly important when you're racing the adversary. Next, simplify. Most hospitals have purchased a lot of things from a lot of companies over a lot of years. For example, with software, you may have multiple products that seem to almost do the same thing. Time to pick one and kill off the other three. And see my earlier comments about modernization. I'm not saying all your stuff has to be bleeding edge or brand new, but you need to be relatively modern and as standardized as you possibly can be. And if you do that, if you plan to replace the stuff that's going past end of life and you simplify your environment, simple is almost always better to run, and it's definitely easier to secure. Fourth, think of all your work in the context of Maslow's hierarchy of needs. All the cool and sexy things you want to do in your health system, like AI and other new innovations, they won't matter if the network isn't up or if you're down because of a security breach. So listen to me. Please don't build your multi-million dollar digital innovation house on a foundation of sand. First things first. Fifth, business continuity and incident response. When the Change Healthcare event kicked off, most health systems weren't really prepared. They didn't know how to do pharmacy claims and rev cycle and other business without the connected systems. And that's a real problem for a lot of reasons because there's many organizations who don't have written and exercised business continuity plans around all of those kinds of operations. So I can tell you one of the things that happens is that your business and clinical leaders probably start putting pressure on your security teams to reconnect to those questionable systems sooner than necessary from a risk perspective. The lesson here, talk about in advance these plans. And when you have to disconnect from a third party because of a security incident, know what the rules of the road are that allow you to reconnect and who gets to make that decision. It's critical, and it probably should be made in the executive suite. Sixth, third party risk management. It's incredibly difficult in general. Most hospitals don't evaluate this kind of risk well. They often struggle to secure themselves, let alone oversee the security status of hundreds of partners. We've also had a massive movement in healthcare towards software as a service, meaning that instead of buying and installing software that runs on servers in your data center, you've decided to buy a subscription to software that runs through your web browser in somebody else's data center. And that's not a bad decision. It's probably actually a good one, but it introduces a new kind of risk. And because we've really leaned into that software as a service model, most healthcare organizations have a large number of these kind of third parties who have access to their data. Managing these third party risks are complicated and they take a lot of time. One place to start is contract language. How much data do they get? How long do they retain it? How many minutes do they have to notify you that they suspect that they're having a cyber incident? Again, this is a really tough one. And as an industry, we have a lot of work to do here. And lastly, and just briefly, data. Do you know where all your protected health information is? Do you really know? Because I guarantee it's not just in your EHR, it's in reports that have been sent by email, it's in clinic spreadsheets and locally created databases. It's in file shares all across your network. And if you don't know where it is, it's incredibly hard to protect it. And as it turns out, it might be tough to understand what data you've lost when an e-crime syndicate steals it. And I guarantee that is not a conversation you want to have with HHS or state privacy regulators. There's hundreds of other things, including the calls I get from my hospital friends when clinical systems go offline for a long period of time. As one example, my conversation with nurses, they always wind up asking me or talking about being afraid of losing their licenses during these extended downtime situations. Without the EHR, they worry they'll make an honest mistake and that'll impact a patient and that they'll lose their license because of it. Your clinical teams are already burned out. Cyber events just make that worse. And look, you're all in different places, different levels of cyber and infrastructure and data governance maturity. I get that. You all face different political issues internally. And I haven't really even talked about budgets yet. Try not to be overwhelmed and don't try to solve all the challenges at once and just acknowledge that they're there and keep working and document everything. If you'd like to know more about my work and some of the great events coming out of the 229 cyber and risk community, check us out at thisweekhealth.com/cyber or send me a note directly at drex@thisweekhealth.com. Thanks for listening. Like and share this message. Follow me here on LinkedIn and tag friends who need to hear this update. That's it for this special edition of Unhack's 2.5 minute drill in overtime. Stay a little paranoid. I'll see you around campus.